We always clean the skin very well to make sure that we don't have any infections. And fortunately, the chance of any infection or really any complications with the PDO thread lift is extremely low. The first thing I always do is mark out the vectors of where the thread lift is going to be performed. So for example, I'll mark out little vectors to lift the cheeks and also to lift the lower jowl and to make more of a V shape of the face. For the smaller threads, the smooth threads, we'll make a little hashtag and put those smooth threads like a net, like a scaffolding, and that will tighten the skin and produce a tremendous amount of collagen. For the anesthesia, we will inject a little bit of lidocaine in the areas that we're going to be making our needle pokes. Nicely is that the threads are actually on cannulas, and so typically we see very little, if any, bruising with the procedure. We then will numb the tracks that we're going to be placing the threads, again with a little bit of additional lidocaine. And the patients are totally awake. There's no sedative on board. There's no anesthesia. There is a slight amount of discomfort during the numbing process, and then after that they simply feel a little bit of pressure, and patients find it very comfortable, even more comfortable than some Botox injections. Once the thread lifting is performed, I make sure that everything looks symmetrical, everything looks perfectly placed. And then the threads are trimmed at the skin. After the threads are trimmed, we then place a little bit of antibiotic ointment on the little needle poke that we've placed, and then we review the post-procedure instructions with the patients, namely not working out for 72 hours, not rubbing or massaging their faces, and when they do wash their faces, to wash in the direction of the lift for 1 week.